Hey guys. So we are going to talk about some cardiovascular conditions, and based on some of the feedback that I got from you guys from this past week, y'all were really interested in dysrhythmias, which fantastic because I love dysrhythmias. So although I do have this PowerPoint put together for y'all to be more for y'all to just read through it yourself. I did want to kind of make sure that it was explained well so y'all understood it. Now I know that we're not testing over the material, so you may think, oh, as long as I just answer the questions, whatever. But some of y'all are really interested in this, so I wanted to make sure that it was explained well, so that you would know what it is. Now, of course, if you're going into the medical field, you're going to look into this a lot more in depth. This is really just scraping the surface. I'm trying to keep it as simplistic as possible, because I know I'm not there for you guys to answer questions and stuff like that. So that can be kind of difficult via over the internet like this. So I'm going to kind of walk you through this. I'm not going to go through every slide and talk about it. Again, some of these, so there's questions in here. So y'all are going to answer that on your own. There's videos in here, which I'm not going to play. So you'll just, as you walk through back through it yourself, then you can play the videos then. Okay. So reviewing the conduction system. So this is from last week. We looked at the conduction system and how it worked. So again, there are specialized cells within the heart that are going to control the heartbeat. So everything starts in that SA node, which is in the right atrium. So it's at the top of the heart. It is the originator of the heartbeat, called the natural pacemaker. So it is going to start the whole beating of the heart in the beginning. Okay. So that signal originates there. Remember, the brain has no control over it. The heart does it. It's on its own. So the signal is going to originate there. It's going to tell the whole top of the heart to beat. And then that signal is going to reach the AV node, which is going to delay the beat by just a second. And then it's going to tell the bottom of the heart to beat. And that's going to go through the bundle of His. It's going to go through the bundle branches and then out to the Purkinje fibers. Okay. So as that kind of works, it is going to make the heart beat. And because it's an electrical signal, we can actually monitor that on a machine by reading those electrical signals. Okay. So I do want to kind of point out here this sentence here that says that it has to happen in a particular order in order for the heart to pump correctly. So if you alter or you change the speed, or maybe a signal is not able to reach a certain location in the heart, it is going to change how the heart beats. So that is definitely, you need to know that. Okay. So again, looking at the electricity that's flowing through the heart. Here we can see what we call an EKG or an ECG. Technically it's ECG because of the letters that are in here. So E for electro and C for cardio and G for gram. But it's referred to as an EKG. I don't know. That's the way I hear it all the time. I refer to it as an EKG. Whatever. Okay. So one heartbeat is from, you can see my pointer here, at the beginning of this P wave. So you see this P right here. So that is the beginning of the heartbeat going through the QRS and going through the T. Okay, so PQRST is one heartbeat. That is the top of the heart beating, that is the bottom of the heart beating, and then it sits there and relaxes before the next beat. Okay, so this P, what we call a wave, this P wave here is the signal that's being shot out to the rest of the atrium or the top of the heart, signaling it to beat. Okay, so that's what the P wave is. So that message gets sent out. So we can see that little blip on the EKG. Okay, so the message gets sent out, the heart reacts to it. Then the message is sent out to the ventricles. So it's going to go through the AV node, the bundle of His, the bundle branches, Purkinje fibers. So it's got to travel quite a ways. So this bump is a lot bigger. So the QRS signals that the bottom of the heart is being told to beat. Okay. What is also happening within this QRS is that the top of the heart is resetting. So if you see this little box out to the side, so it says that the heart has to reset in order to beat again. So if you imagine yourself jumping, okay, you've got to prep and then you jump, okay. So in order for you to jump again, you first have to land, you have to prep, and then you jump. The heart has to do the same thing. So because the atrium just fired, which was the P wave, it has to reset. And that resetting happens during this QRS. Okay. So the QRS, again, like I said, is the bottom of the heart is being told to beat. Okay. And then just like the atrium had to reset, the ventricles have to reset, and that's what that T wave is. Okay. So P wave, top of the heart is told to beat. It resets during the QRS. The QRS is when the bottom part of the heart is told to beat, and the T wave shows that it reset. Okay. And then there's a pause, and then it starts all over again. Okay. So this is textbook normal what a heart rhythm is supposed to look like. Okay. You have your P wave, your QRS, your T wave. This is how much space should be between each of those waves. This is how tall the QRS waves are supposed to be. This is textbook normal, okay? So when we start talking about dysrhythmias, anything that does not look like this means that it's not right. There's something wrong with it, okay? Now, there are going to be slight variations from person to person, things that are going to be considered normal even though it doesn't look exactly like this. But for the most part, your heart rhythm should look like this. Okay. So on the next slide, I have y'all watch this short video. Now the short video says right here, timestamp. You're looking at like 5 seconds of a video. Okay. So feel free to hit this play button over and over and over again. Okay. So if you hit the play button here, it's only going to play this particular timestamp. Okay. So it's going to show it to you. So you may have to play it a couple of times in order to answer this question over here. So feel free to do that. Okay. So again, a dysrhythmia is when the conduction system is not working properly. So that can be a timing issue. So again, this part of the heart beats and then this part of the heart beats and it's how fast it gets through there. There can be a timing issue. There can be a delay of the signal. Okay. So especially if you're talking about once you pass the AV node. So once you pass the AV node, you go through the bundle of His, and then you have the two bundle branches. You can actually have a delay where one bundle branch will send the signal through really fast and the other one will kind of slowly go through, and that will cause an issue. There can be a complete stopping of the signal. So once it gets to the AV bundle, it just stops and it doesn't progress to the branches or the Purkinje fibers. That would also cause an issue. Okay, so there's tons and tons of different dysrhythmias out there. We're only going to look at a few. You're welcome. Okay. Now I worked on a heart floor. I wasn't like tip top, ICU heart floor, but I was on your typical heart floor. So we had to go through rigorous training of learning how to read EKGs because we had to be able to interpret what our patient's current rhythm was. So I've been through this training a lot. Still got it a little bit. So I'm pretty well versed in a lot of different rhythms. But like I said, we're not going to go through all of them because that would be okay. So we're going to start at the top of the heart and kind of work our way down. So we'll talk about problems with the top of the heart first. So we have atrial flutter and atrial fibrillation. Okay, so these are two different rhythms here, but just kind of putting them on the same slide so you can see a comparison between the two. Okay, so with atrial flutter, you can see all of these various P waves in here, okay? So you see 1, 2, 3 P waves to a QRS, okay? Now let's go back to normal real fast. How many P waves do you see for every QRS in this one? Okay. So with this one, we're seeing 1, 2, 3, 3.5, because there's a little blip right before you have your QRS spike there. So you're seeing about 3 P waves for every QRS. Not normal. Okay, so this is what we consider atrial flutter. It's often described as a saw-bladed appearance, so it looks like a saw blade. Now, something that you can see from this is that the rhythm still looks regular, okay? So you have about 3.5 P waves for every QRS. So the distance between the QRSs are still the same, okay? So nothing's really changed there. But we see more than 1 P wave than we should, okay? Now with atrial fibrillation, this is also called AFib. You hear these on commercials a lot because this is a very common dysrhythmia, okay? So with this one, can you see the P waves anymore? It doesn't look like there's anything there, but they are. It's just happening so fast that there's not time for an actual wave. With a fibrillation, it's more of the heart is quivering versus actually beating. So instead of beating, it's sort of like wiggling, okay? So we're going to pick up those wiggles on the EKG. So all of this bumpy line down here, that's actually the top of the heart moving, okay? So it looks like it's absent, but it's actually there. It's quivering, not beating. And this beat is no longer regular. So looking at the QRS spikes here, they're not evenly distributed. So we have a really big gap here, smaller gap, even smaller gap. Okay, so it's no longer regular. Okay, so let's discuss why that is. Okay, so remember the SA node was the natural pacemaker. It's the thing that tells the heart to beat. Okay, with both of these rhythms, we have multiple things within the heart, the top of the heart, that's telling the heart to beat. So now you have multiple people you have multiple people basically trying to tell the heart when to beat. So like the saying, there's too many cooks in the kitchen. There's too many signals going out telling the heart to beat, and the heart really doesn't know which one to follow. So it kind of just will listen to one of the signals every once in a while, which kind of leads to these weird heartbeats. Okay, so again, the top of the heart is responsible for pumping the blood to the bottom. Okay, so when the top of the heart beats, it squeezes, and it only squeezes the blood to the bottom of the heart. So it's not really that much of a distance. So if the top of the heart is not functioning correctly, it's really not that big of a deal. Okay, so it's not as huge of an issue as if we're talking about troubles with the bottom or the ventricles. If these are not working properly, the ventricles, then that's a whole nother ball game. Like that's life threatening. When you're talking about the top of the heart not working correctly, we can fix it with some minor things, and we're okay. Okay, so treatment for AFib can be controlled with medications for the most part. You will see those advertised on TV a lot. And then you can permanently correct it by a procedure called a cardioversion, which is kind of like when you do the charging and the shocking with people, except it's a smaller amount of electricity. It's not as intense, and then the patient's asleep. So you can cardiovert them, and then you can put their rhythm back into a normal rhythm. Now, it doesn't always work. It may last days, weeks, months, years, and then it will go back right into the rhythm that it was in. So that's why I say permanently, because it's not always a permanent fix. Okay. So that is atrial flutter and atrial fibrillation. So let's look at ventricular tachycardia and ventricular fibrillation. So ventricular tachycardia is also known as VTAC. So you'll hear this a lot in shows. You'll hear a doctor say, "Oh, the patient went into VTAC," and then everybody panics. So with tachycardia, tachy means fast and cardia is talking about a condition of the heart. So this literally translates to fast heart. So this is a heartbeat that is greater than 100 beats per minute. Okay, so the ventricles are beating too fast to maintain good circulation. We are not pumping out blood enough to maintain our vital organs to continue to work. Okay, so this will progress to cardiac arrest or a stopping of the heart. Okay, so if we look at this down here, all of these bumps are actually the QRS wave. So if we go back to our original QRS, nice spike. There's one every once in a while. They're not this close together. Okay, so we've definitely sped up the speed of this. I would say that this is probably about 200 beats per minute, which is way too fast. So usually you see this described as it looks like gravestones. If you leave them in this particular heart rhythm, they will die. Okay, so that's why they say they look like gravestones. So we have to get this patient out of this rhythm because again, the bottom is beating too fast. We can't get a good pump of blood out. Okay, ventricular fibrillation, also called VFib, looks like chaos, and that's basically what's going on. So again, fibrillation, meaning that it's just wiggling or quivering. So they're not actually beating. So we're not having a good beat of the bottom part of the heart. It's just sort of moving, which means we're not getting any blood flow out from the heart. Okay, so again, this will progress to cardiac arrest. Okay, so you cannot see basically any waveform. Now, maybe here this kind of looks like a QRS right there, but basically it's just sort of my child scribbling on a piece of paper is what it looks like. So again, we've got to get this patient out of this rhythm. So let's look at our interventions for this one. Okay, so for both of these situations, the heart is beating too fast. We cannot pump adequate blood out in order to maintain function of our vital organs, which means the patient will lose consciousness, meaning that they'll pass out, and they will eventually die from it if we don't do anything. So we have to do something for them, and that can be CPR, but the best bet is to use a defibrillator. Okay, so I have a defibrillator. This is one you'll see in a hospital. It's also called a crash cart, patient care. So you have to get one of these out. You have to connect your patient to them, and you have to shock them. Okay. So this next video shows a defibrillator being used. This is obviously a dummy. So then you have some questions about that. You can actually see the rhythm on the monitor, and they tell you the first rhythm, but if you can kind of guess it before, it'd be kind of cool. And then just another question there, so we'll keep going. Okay, so asystole is our last one that we're going to look at. And this is when somebody goes into cardiac arrest, this is what the rhythm looks like on the chart, which is asystole. So A means without, and systole is talking about a contraction. So it's literally without contraction or no heart movement. Okay. So this is a stopping of all heart activity. There is no electrical pulse going through the heart at all. Nothing is happening. It's just sitting there doing nothing. Okay, so there may be a couple of bumps on the monitor. So you may see something like this, but that can be a random electrical signal, which the heart's still not doing anything, or that could be like if somebody's actually moving the patient, it'll show up as something moving. Okay, so only CPR can be performed in this scenario because common misconception, you cannot shock asystole. I am tired of seeing this on TV shows and movies and stuff. You cannot shock it. Okay, the only thing you can shock is a rhythm. It doesn't matter how chaotic the rhythm is. It can be this, but you can shock that. You cannot shock a flat line. Cannot do that. Okay. So that's something that you cannot do. So for funsies, you can look up a medical show on YouTube just a clip, not with the whole 45-minute show, just a clip of it. And I tell you how to paste that video right here and then show me all of the crazy stuff that y'all find on YouTube. Because they're really funny because they're like, oh, Claire, we're going to shock this patient. And they get it back and, the doctor saves the day and you can't shock them. But anyways, okay. And then the last part of this is you are playing a doctor. So I'm going to show you a couple of different rhythms. You have to identify what the rhythm is and what you're going to do about it. So basically that is it for this week. I hope that y'all enjoyed this activity. Don't stress if you don't quite get it. If you have questions, let me know. Email me. We can video chat either way. But hopefully you guys are doing fine, and I will see you guys later. Bye.